Good morning, everyone. My name is David Morrow, and today I'm going to be talking about the future of health policy within Virginia. Uh, this is attributed to my American Military University class, Health Systems and Health Policy, taught by Dr. Tony Ann Loftus. I could be saying it wrong, but in this video, I wanted to discuss the three health issues that I had seen and did research on when it comes to Virginia citizens and the policies that I had proposed to be able to circumvent those issues and mitigate the risk. The one issue that I had talked about was the opioid overdoses. Opioid overdoses seems to be the highest rate of fatalities within Virginia, and that supersedes the vehicle fatalities and gun fatalities within Virginia, and is one of the most highest overdoses when it comes to drug use in Virginia. And that was one of the key points that made me want to actually dive deep into the opioid overdoses. The second one is the maternal health disparities. It's a great disparity of maternal health when it comes to African American patients um, in various ways. Some are treated different, some are, their pain level is supposedly not the same compared to other patients, and they are treated differently based on sometimes their insurances. And the last thing that I wanted to discuss when it came to the health issues in Virginia is the lack of primary care access and the barriers to entry to primary care access. A lot of people live in very rural areas and have a lack of transportation or very far clinics and hospitals from them. So it caused an issue when it came to being able to give people the primary care access. Although Virginia has expanded on its Medicaid to be able to give people access to health insurance, it doesn't do it any justice whenever you have a lack of primary care access due to things such as transportation and lack of hospitals in certain regions. The one key point that the one policy that the three policies that I created to mitigate the issues and risk of these were first the medication assisted treatment and the Narcan distribution for the opioid overdoses. That would be designed to be able to create a way for patients that do suffer from any kind of addiction issues to be able to have access to healthcare that would really be attributed to fixing their addictive issues. And the Narcan distribution would be able to help those that, and again, in rural areas that have clinics and hospitals that are 5, 10, sometimes 20 miles away from them, have access to be able to mitigate the uh, overdose with Narcan, at least until EMTs or some kind of provider can show up to be able to help them. The second policy I proposed was the community based maternal health programs. This will allow community health workers to be able to be in the field to be able to help those patients that have a lack of access to care or or and actually see them in their social economic gaps that exist within this nation. You have those community health workers that are going out to those actual towns and cities to be able to assist those people in the best way in educating them and giving them treatments and access to different kind of prescriptions, so that way they don't have to figure out a way to actually get to other parts of the city, and also to deal with different disparities that they would experience at the hospital. This actually will give the clinician like time actually in their space, so that way they can see the actual things that they're dealing with. The last policy I proposed was for telehealth access. With telehealth access, it gives everyone access to primary care across the board, so that way whether you live in a very rural area and the nearest hospital to you is 15, 20 miles away, clinicians still would have a way to be able to have access to you, so that way they could be able to give you the best care and treatment that you need. Although it may come as an issue when it comes to certain examinations and things of that nature, I believe that telehealth has come very far when it comes to being able to look at those different things that people are suffering with when it comes to pictures, videos, and things of that nature. The particular policy that I had chose that I feel that would be the best when it comes to changing the scope of things for people in Virginia is the medication assisted treatment and the Narcan distribution. The reason why I chose this policy as like the best policy to be able to help other people is because when it comes to opioid overdoses, you're seeing a lot of things happen, kind of a snowball effect. Patient overdoses, and then now they're in the hospital, and then they go out and just pretty much do the same thing over again. And now you're having readmissions, you're having people take up ICUs, you're having EMTs kind of assess and do the same, deal with the same kind of issues over and over again. And I feel like that would be the best choice for clinicians, because clinicians need to be able to have access to other people. They need to have access to other issues and problems that are going on within the state. Because if you're seeing the same person over and over again for readmissions and issues that they're dealing with, it would just become a bigger problem. And although yes, the expansion of telehealth would be great for people, it doesn't help whenever you don't have assistance for an actual addictive issues. So with clinicians, yes, if you have that telehealth access to be able to access to those people in different areas, it doesn't help whenever it doesn't really, when there's no actual way to help somebody through their addictive issues and personalities. Another thing is that why I feel like it would be the best thing for Virginia and the best thing for clinicians, because with the Narcan distribution, it would be essential when it comes to actually saving someone's life. Somebody overdoses, and then with the Narcan distribution in those areas that have high amounts of opioid overdoses, people such as myself and others that are around them would be able to give someone Narcan to save their life, or at least help them out until an EMT or some kind of provider could get there to be able to assess and figure out what the next steps would be. But also on top of that, once that particular patient that had to have the Narcan and opioid overdose and the provider is able to get to them, they have a way of rehabilitation. They have a way of being able to take the steps to be able to better themselves in the best way possible. We've seen this in different areas such as New York, Ohio, Kentucky, where they did a Narcan distribution, specifically New York, when in the time that I was there, they opened different clinics such as methadone clinics, where addicts would be able to go there and be able to wean themselves off of certain addictions. But not only that, they also had different things that they provided while they were at that particular facility. Social workers would come by and assess their social economic issues and see what's the best way to mitigate them, and also give them resources so that way they can find a way to get out of the problems or loop that they're having. And then the second part of that is that they also had mental health counselors to kind of assess where the actual problem starts and get to the root cause of the issue. And I feel like Virginia would be able to very much improve from that when it comes to opioid overdoses. Because when we're talking about the overall health policy development, we're talking about not only just minor things, we're talking about big issues that affect the lives and daily lives of people. If we have opioid overdoses filling up hospitals and filling up different areas of a facility, this leaves a lack of structure for other people, and then that means that other issues that may have arisen that are actual public health issues, we don't have the room for, because we have so many people that are taking up space with opioid overdoses. And I consider that to be the best selling point to establish as a priority for advocacy when it comes to policy development, because when we're looking at the overall aspect of opioid overdoses, that's something that not only this generation of people have to deal with, that's also the generations that come after. Is that if we don't do anything about it, that number will just continue to grow and grow, and now we have our children and grandchildren and things of that nature suffering from those same fates because Virginia failed to act. We need to be able to put in place a way to mitigate that risk and give people the chance to be able to make themselves better with the medication assisted treatment facilities, and also having the Narcan distribution, because we're looking at areas again that they may have hospitals and facilities that are 5, 10, 15, 20 miles away, and if that be the case, children are seeing their some of their parents, friends, families suffer from the opioid overdoses, and they have no way of actually getting the help and care that they need. With the medication assisted treatment facility, this would be allow this would allow us to be able to assess overall what the actual issues that Virginia is facing in certain areas, and also to see how we can close the gap of the socioeconomic issues that people face. We're talking about housing and food and things of that nature. We're talking also about like the mental health capacity of people, why people are the way they are, what attributed to that, and you can find out more with reports as you're dealing with those people in the medication assisted treated facilities. You can find out more information about the areas that they live, and also with the community health workers being able to distribute Narcan to those particular areas, they can see for themselves that certain areas might will do have a lack of um, oversight from the government, and not in the sense of laws and policies, but in the sense of the government has not done anything for this particular area. So the opioid overdoses have been growing in this particular area, and would be one way to improve Virginia, so that as a nation we could meet the same guidelines as places such as New York, such as Kentucky, Ohio, where they've had a, a very huge amount of opioid overdoses, and was able to mitigate that risk with different things such as Narcan distribution and medication assisted facilities. If I remember correctly, New York was dealing with a fentanyl overdose issue in my time there, and when they started to do the Narcan distribution and open up the methadone clinics so that way people could be able to get the care that they need and look at the actual issues that those people are having in certain areas, this helped the overall public health to reduce the amount of fentanyl overdoses in that particular area. Now, again, I'm from Buffalo, New York, so this was like a staple and a big change for Buffalo, New York, because of the fact that they were able to open that clinic and be able to have those patients come in and assess their actual social economic issues, and have social workers be able to help them out in the best way possible. Little things such as getting Medicaid and or Medicare, getting housing, getting food, giving them the resources to be able to become an upstanding citizen. And I feel like Virginia lacks in that when they don't have a medication assisted facility to be able to assess the opioid overdoses, because with that number being higher than vehicle fatalities and gun fatalities together, that is problematic. That's very, very problematic, and I feel like this would be the solution to be able to help the citizens get back on their feet in the best way possible that suffer from opioid overdoses or opioid addictions. And that would be the best policy that would assist Virginia and its citizens, so that way clinicians can have more time back for public health issues that may be on the rise, instead of just dealing with opioid overdoses consistently over and over again, and readmissions and overutilization, and hospitals not getting paid for those things because people don't have certain insurances and things of that nature. Again, my name is David Merle. This is my video presentation for the future of health policy in Virginia. If you have any questions, please feel free to contact me.